Okay, so I'm doing the recording for the first hour of class tonight, and we're going to be looking at the information in your Calculations with Confidence book and some things that you'll need to know when it relates to how to write orders, read read MR, which is your medication administration record, and how to read labels. And all of this information is going to be on test 4. So once you're finished this, you'll go under quizzes and you'll have a quick little quiz related to this content. So I am starting on page 151, which is chapter 10. In chapter 10. So we have to make sure that you always have the components of the medication order. So you want to make sure that you have the full client's name, the date, and the time the order was written. Also, you need to have the name of the medication, and that could be, they could order it as generic or brand name. So you also want to make sure that you have the dosage of the medication, okay, the route of the medication, and the frequency of the medication administration. And then if it's a PRN medication, you also need to know why it can be taken. So if we're looking down at the bottom of page 156, it says interpreting a medication order. So you're going to have the name of the medication. You're going to have the dosage, 100 milligrams. Okay, you're going to have the route, PO, and the TID, which is the frequency. And if you've learned your abbreviations, that TID means 3 times a day. So if you have an order such as this, Buspar, 15 milligrams PO/BID, it means that you're going to give Buspar, which is a long-acting medication for anxiety, and you're going to give that 15 milligrams by mouth, so orally, 2 times a day. So if we go back up to the top part of this page, we're also going to take a look at some of these medication labels. So sometimes when you receive medication, it's not necessarily in a bubble pack that you would see in a nursing home, but it may be in an individual box, or it may be in an individual sealed package. And so on that, you're going to have the name of the drug. So anytime you have a capital letter, okay, and a lowercase letter word, that is going to be how you tell the difference between the generic and the brand. So if you have 2 names on there, the lowercase one is always going to be the generic, and then the uppercase or the capitalized one is going to be the brand name or the trade name. Now, if there's only one name on here, there's not a second name, whether it's lowercase or not, then it's going to be generic, because by law, they have to put the generic name on the labels. So if there's only one name, then it has to be generic if that is mandated by law. Then you're going to have the milligrams or the dosage. It could be in micrograms, it could be in milligrams, it could be in different, whatever the dosage comes. So you can also usually see on here, it's usually going to have an expiration date, and then it's going to give you a little bit more information about how to store it, who it was distributed out of. So if we look at this, scroll down a little bit, and we look at this next one, we have a metformin hydrochloride tablets, 500 milligrams. Now, as we can see, there's only one name on here. And what I just said was, if there's only one name, it has to be generic, because that's what the law says. So metformin hydrochloride would be your generic name. Your brand name or your trade name for this medication is Glucophage. So they are 500 milligram tablets. So again, it's going to give additional information over here. and then there's usually going to be an expiration date. So anytime you give any medications, you always want to check that expiration date, because you want to make sure, number one, that you're not giving something that's expired, because if it's expired, it's not going to be as effective. And some medications turn toxic when they expire. So as we move down, we're going to talk about those routes of administration. So it could be PO, which is by mouth. It could be ID, which is intradermal. That's going to be like your TB test. Your IM, which is intramuscular, so your injections into your muscles. And then your IV, which is your intravenous, and that's going to be within the venous system. It's going to go straight into your veins. So you also want to make sure that you have the time and frequency of the medication, because if not, you don't know when to give it or how often to give it. So it could be BID, it could be QD, it could be TID, QID. And again, if you don't know what those abbreviations are, you need to go back to, I believe it's the prior chapter, chapter 9, and it has a whole page and a half or so of abbreviations. And we talked about that those are abbreviations that you need to become familiar with. And also, you will have some of those abbreviations on your calculations exam in this class. So every order must have a signature of the person writing the order. And so if you are taking a verbal order, then you would have the order written, and then you would have, let's say it's a telephone order, then you would put TO for telephone order, RB for readback, and we're going to talk about that a little bit more tonight, and I can write some examples on the board. As y'all can see, I've been recording a little different. I'm having some issues with my Zoom account right now, and I've been back and forth with them since Friday and trying to get that all worked out. So this is the only way that I have to record right now, and that's why it was such a delay in me getting the other videos done, because I had to figure out how to record them. And then, of course, as y'all seen, I had to upload them to YouTube in order to get them to y'all. So I can't really do any writing or anything to show it to y'all because of how I'm having to record right now. So if someone could please remind me to show y'all how to write that medication order and signing it off as you took it and from what doctor tonight in class. So interpreting the medication orders, this is what we were talking about just now. This has to be in every single medication order that you have, and it has to be in this order. Also tonight, if somebody could please make a note to also show y'all some of the facilities that we use. They do one additional step in addition to this, which is telling you exactly. Anyway, just remind me to write to tell y'all, show y'all when it talks about the medication specific sequence of putting it in, and then how some of the facilities that we use also does it. Okay, so points to remember. This is 7 components of that medication order that you must have. The patient's full name, the date and time the order was written, the name of the medication to be administered, the dosage of the medication, the route of the administration, the time or frequency of administration, and the signature of the person writing the order. If any of these are missing, then you would have to contact a doctor to get a clarification order. Okay. All right, so here's some practice things down here. So PC is going to be AC, HS, PC, AC. This is after meals. Okay, so sometimes I have a certain little way that I remember things. Y'all probably just heard me talking and saying different abbreviations to myself, and that's kind of how I remember it. PC is not one I use a lot or see a lot, so I always have to go back and really think about what does that mean. H means hour. Q12H is Q12 hours, so every 12 hours. Q means every. BID is twice a day, and then PRN is as needed. Now, You would next have these orders here, and you would need to interpret them to see would you administer them or give them at the beginning of the sentence. Okay, so so this one is Zytovenidine, 200 milligrams PO Q4 hours. So it's got our drug, it's got our dose, it's got our route, and it's got our frequency. So yes, okay. The let's see. Let me look at a few of them. Let's see. All right, so let's look at this 14, number 14, Mylanta 30 milligrams PO Q4 hours PRN. So we have our medication, we have our dosage, we have our route, we have our frequency, and then it's PRN. But what is missing? So the indication or why we're giving it is missing. We need to know what that indication is, okay? So again, this is some that you can review through, you can answer them, and then you can look at the end of the chapter for your answers. All right, so again, these are some more abbreviations. Again, try to do these abbreviations without looking at the answer, and then see if you can get them, okay? Because again, you're going to have probably, it's usually about 3 or so on those calculations exams. All right, write the abbreviations for the following, okay? So now, can you look at these words and write those abbreviations? All right, so these are some more practicing on interpreting the proper drug dosage. All right, let's see. All right. All right, so let's go to chapter 11 now. This is page 165. Okay, so again, we talked about again what's needed in those medication orders. Okay. All right, so let's talk about the medication administration record, or your MAR, M-A-R, and that's really what you're going to hear everybody call it. Okay. On your chapter 4, or excuse me, exam 4 exam, you will have a MAR, and we'll have to answer questions from it. We need to make sure, can you understand a MAR? Can you read it? Can you know what you're looking at? Okay, so your MAR can be a handwritten MAR, or it can be electronic, and it just is going to depend on where you work. So a lot of your LTACs, or your long-term acute care centers, use paper MAR still. And what an LTAC is when the patient is not sick enough for the hospital, but they're too sick to go home. So it's kind of like an in-between step. So you're going to have the information for your client up here, which is going to be their name, their room number, date of birth, medical record number. All of that is usually going to be up here at the top. You're going to have their diagnosis, their allergies, and they have NKDA, which is no known drug allergies, and then the date. So this date here is what day of the week that the MAR was printed. Okay. Then you have, okay, I hope y'all can see what's on my screen right now. All right, so then you're going to have the order date. Okay, so this is when the order was written. This is when it's going to expire. So the order was written on 4/2/20. It means it's good until 5/2/20. They're not going to give this medication anymore after 5/2/20. The RN initials, you don't really see this a lot on MARS, this column here, but usually what this is the initials of the person either writing the orders in or either checking the orders at the end of the day. So we have Colace, 100 milligrams, PO BID. So Colace is a stew softener. So it's BID, so it's going to be twice a day. So they have 9 and 1700. And y'all, the way that you know what times to write in for BID, TID, QID, Q day, hours of sleep, all of that's going to really determine by your facility. Okay, so every facility is a little different. For the most part, they're all pretty much in the same ballpark, but they're going to vary. So whenever you orientate at that facility, then you are going to learn what their standard times are. Then you have your days of the week here, or the dates of each day. And then as these medications are given, that nurse is going to initial off. Okay, so now, do we know who DG and NN is? No. So we're going to look down here at the very bottom where it says initials, print name, and title. Then that nurse, every nurse who uses this more, who writes anything and signs anything and puts their initials, they have to put their initials at the bottom, and then they're going to put their name and their credentials. That way, whoever follows you, or if it's 10 years down the line and this patient goes, for some reason, is in a lawsuit and this goes to court, they know who those initials belong to. If it's not initialed, that means it's not done. It means that medication was not given. Also, if the medication is not given, then you would, actually I'm going to wait and talk about that one at another time. Alright, so next we have furosemide, 40 milligrams PO daily. Okay, and y'all should know what that is. That's a loop diuretic. It's the generic for our Lasix. And you have it once a day. Okay, so we have 0900. And then on these 2 days we have the initials of the nurses. Now, whenever let's say this is your patient, you're going to have to, when you're at clinical, if this is your patient and you're pulling 9 o'clock meds for them and they have furosemide, what else do you need to bring to me, right? You got to bring the most recent potassium level, okay? And then you need to know, is that within normal ranges? So if your patient's potassium level is a 3.2, then you need to be able to tell me yes or no. Is that normal range for the potassium? Then you have KDOR, 10 milliequivalents POBID. So KDOR is a potassium supplement. And again, that one's twice a day. So you want to make sure that you have your times written, and then as they are given, they are signed off on. Now, the next one is for digoxin. And we've talked about dig under the cardiac medications. It is a 0.125 milligram PO daily. So, anytime you give dig, what was the number one thing that we said that you had to do prior? You had to take that apical for a full minute. So again, if you have this patient and this is their medications and you have me in clinical or any instructor in clinical, you better know what that apical was prior to coming to check off those medications. Plus, before you give it, you better take it again, because let's say you check that apical when you go in that morning. It's an hour later before we check off meds. It's another 15 minutes before you go in there and give it. Can that patient have a change of status in that amount of time? Absolutely. So with digoxin, we hold it anytime it's less than 60, we hold it anytime it's less than 60. And then this order says that they also want it to be held if it's greater than 100. So they also have a line, apical pulse. So you're going to sign it off. You're going to write the apical. And in that way, if anything issues happen after the case, you can say, okay, well, when I took it this morning, it was 76. Okay, or but when I took it this morning, it was 80, and now it's 45. Okay. The other thing, anytime you're giving this potassium or this Lasix, what I want you to get into the habit of, even though it doesn't have a slide on here, as a nurse, for myself, I'm going to write in here, potassium 3.2, potassium 3.2, okay, dig, apical 76, okay, we want to know what, what I want the people who's following me to know that, hey, I did check, and this is what it was. Same thing with furosemide. What else should we check before we give that Lasix? I need to check that blood pressure, right? I'm also going to write my blood pressure in here, okay? So, yes, it doesn't ask for it, but it takes 2 seconds to write it in there, and down the line, if anything ever happens, it's going to cover you, okay? It's going to cover you. You'll know, okay, I did check that potassium. I did check that blood pressure. This is what it was prior to taking it. All right, so as we move on, this next more than copy on page 166, this is a picture of an electronic more. Okay, so you're going to have the usually they have the patient's name up at the top, but you're going to be within that patient's chart, but it usually still gives you the patient's name at the top, just so you can look and make sure that you're in the right chart. Okay, but I don't see where there's a name on this one. Okay, so it's going to have the medication, it's going to have the dosage, it's going to have the route, the frequency, and the indication if needed. Then, if it's given, it's going to mark the time that it's given. So whenever you click that this medication was given, it's going to pop up at the time and say that it was given. If it's a medication that's not given and you click not given, then what's going to happen is a little box is going to pop up that you have to explain why it was not given. Okay, and then anybody who follows you, they can hover over that or click on that and see, okay, the patient didn't take it. She didn't take the multivitamins with minerals. Reason why is because the patient or the family refused. Okay, now on these, let's see, sodium chloride infusion. So this is their IV. They're getting 100 milliliters an hour, continuous. So their DIG. Okay, so let's say, well, it is held. So they held this DIG. So why would be a reason that they held the DIG? Could it be that the apical was too low or the apical was too high? Okay, then what's going to happen is when you click on the whole, they can usually right click on it, and then they're going to put in why it was held. Okay, the other thing is where your atenolol. Okay, so that OL is telling us what? It's a beta blocker, right? So if it's a beta blocker, I have to take what before I give it? I want to take that apical, make sure that it's not less than 60, and then I want to take a blood pressure. So I could right click on this and I can plug in that data. Again, it's showing that I did check the apical, I did check the blood pressure, and this is what I got. All right, so this is just a medication card. This is a one that's not electronic. So usually there's a lock somewhere, and you carry a key around with you, or there's it's locked, but it's got numbers that you punch in, like a code to get into it. And then each of these drawers are usually labeled with the room number, and then it'll have medications in here that are not narcotic or not controlled. Okay. These are going to be your electronic medication dispensing system. And then it says also computer controlled dispensing drawer. So most all nurses, especially old school nurses, you're going to hear us call any automatic medication dispensing system a Pyxis. And the reason why is because way back 30 years ago when these electronic medication systems came out, the first name brand was Pyxis. And so all of us old school nurses say in the Pyxis, okay, even though that's not the name brand of it. Okay, so what will happen is you'll have a code. A lot of them have fingerprint. So you'll go in, you'll click, you'll scan, you'll put your fingerprint down, it'll scan it, it'll allow you in the system. So it's going to track everything that you take out. Usually they have this patient's names listed. You click on your patient, you click on what medications you need, and then the drawers pop open. You take what medication you need out. Okay, this is just another form of a Pyxis. And it's more just cabinets versus drawers. So a lot of your medications that are in the Pyxis are going to be in these barcode medication packs, okay? Because a lot of your hospitals and things are going to where you scan the patient and then you scan the medication. So it's kind of like a additional, not kind of, but it's an additional safety check. Okay, if I scan the patient, I scan my barcodes, and if it pops up and says, hey, beep, 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 your patient's not ordered this, then you would need to stop and go check that order and see what's going on. All right. All right, so AC means before meals, PC after meals. This is a few of them that we talked about just now. So again, this is this table. This is some very common. You really need to know all of these, okay? Not necessarily just for testing, but just for to make your life easier every day in clinical and in nursing, because you're going to see these consistently. All right, so military time. You will have military time also on your calculations exam. And y'all, it starts at 0 and it just goes all the way up to 2400, which is midnight. And so if it's 1 a.m., it's 0100. If it's 2 a.m., it's 0200. If it's 3 a.m., it's 0300. If it's 3 p.m., it's 1500. And y'all, I'm going to tell you, for years, I had to count on my fingers, okay? If it said 1500, then I was like, okay, 13, 12, 13, 14, 15. Like, I'd have to count on my fingers until, to see where I fail with that military time. Now, it's finally, after many years, it's second nature. So, so this is similar to what you will have on your exam. Okay, you're going to have a MAR, okay, and then you're going to have questions like this, okay. So it's going to ask you questions related to that MAR, and then I'm going to see, okay, do you understand how to read that medication administration record, okay. NGN style case study, y'all. I can't stress enough how important it is to do these case studies and really get this practice with the NGN. When you take your pharmacology HESI, you're going to have about 5 NGN questions on there. So you need to understand, like, how are they asking? What are they asking me? How are they being broken down? Okay? And if time allows, we'll do some of these in class together. Okay? Again, this is just another example of something you might see on the exam. You'll have the copy of a MAR, and then you'll have questions to answer about it. Okay? All right, so let's go now to chapter 12. All right, reading the medication label. This is extremely important because if you misread a label, then you can overdose or underdose your patient, and both of those can be harmful. So, as we mentioned before, by law, they have to put the generic name on the medication box. So, if you only see that one drug, atropine sulfate, and no other drug on there, then it's going to be the generic name. Same thing with this one, morphine sulfate extended release capsules. It's only one name on there, so it's going to be the generic. So the box is going to give you your dosage, okay? So it's 0.5 milligrams per 5 milliliters, or 0.1 milliliters per meal. Both of these mean the exact same thing, they're just written different, okay? This is what's in the total container, okay, or the total bottle or vial that's in there. And this is what's per meal that's in there. So there's 5 meals in this vial. So each meal is 0.1. So if I multiply it times the 5 meal, it's going to give me this right here, okay? Then over here, again, we have our drug. It says 20 milligrams, and it tells us that it is in capsule forms, okay? Then also, they're all going to have an expiration date, even though these don't list it, but there's usually an expiration date on here, their lot number, and different things like that. So, next we have furosemide, 20 milligrams per 2 meals, okay? So, this is a vial. This is the total amount that's in the vial, okay? See, right here it says it's a 2 milliliter vial. So in this whole vial, if I gave the whole vial, I would be giving my patient 20 milligrams of medicine. Then underneath there, it's breaking it down to every meal that's in the vial. So every meal is going to have 10 milligrams. And if it's 2 milliliters, and I multiply that 2 times 10, I'm going to get my 20 milligrams per 2 meals. Now, again, this is only one name, furosemide. So if it's only one name, it's got to be what? Generic or trade? It's going to be generic. All right, so now let's talk about the trade name, okay? So the trade name, also you'll hear it called the brand name or the proprietary name, but usually it's either trade or brand name is the way that you'll hear it. It's going to be the capitalized one, and then when there's two names, it's usually always the first name, it's capitalized, and then you're usually going to see that little trademark symbol behind it. Okay, and that trademark symbol could be the circle R, it could be a TM, whatever, depending on however that trademark is registered. Then, remember, that second name, which is lowercase, that's going to be your generic. And again, we have tablets, or you can see down here, it's 60 tablets, and they are 2.5 milligrams a piece. Over here is usually where your expiration date, lot numbers, and all of that's going to be. Let's see. All right, so tall man lettering. So what does that mean? So anytime you see a drug like these, dopamine or dobutamine, if you see these large or all caps, that means that this is a look-alike drug. And what that means is that it's very closely, the spelling of it is very closely to the spelling of another drug. And so they're putting those letters that can be mixed up for the other term in caps to have you make sure that you look at it and do a double look and do a double take and make sure that you're giving the correct medication. Okay? Okay. So again, Namenda, got your caps here. Okay? Memantine is your generics, the lowercase. Okay? This is our dosage. It's 2 milligrams per meal. Okay? And it's got 360 milliliters in this oral solution. Okay? So this is a big bottle of liquid oral solution. So it's a liquid, but it's oral. Okay? So if it's 2 milligrams per meal, and we have 360 milliliters in this whole bottle, if you was to give the whole bottle, how many milligrams would that be? Okay, so if it's 2 milligrams per one meal, if I have 360 milliliters, I would multiply that times 2, which would give me 720 milligrams in this whole bottle. Okay, all right, so again, this is just some more examples for you to look at. It's telling you this is penicillin V potassium for oral solution. So there's only one name up here. So since it's one name, that means it has to be the generic. So the strength is 400,000 units, which equals, or is the equivalence to 250 milliliters. 250 milligrams. All right. Let's see. Now, just looking. All right, we're going to come back and talk about reconstitution, okay, because I actually want to do that in class together. So if y'all could also make a little side note that we need to discuss that. All right, so again, on the exam, be very familiar with what's on the label, how to pick out the information that you need on the label, and the you know, again, just how to read that label, what information's on there, how to tell what's the brand name, the generic name, how to tell where was your expiration date be, also how to tell what the dosage is, okay? All right, so there's plenty of these for you to practice through, okay? So you want to make sure that you are reading all these, you're doing some practice questions or practice labeling, and let's see, we should be able to get to some practice somewhere down here. All right, let's just talk about some other things. So single dose and multi-dose packaging. So single dose just means that vial, when you pop the top and you draw the medicine out, that's the only dose you're going to get out of it. Okay, the multi-dose is going to be when you take the top off that vial and you use it, you're going to use it multiple times. So think about insulin, okay? When you open a bottle of insulin and your patient is using insulin, they're not going to just take one dose out of that whole bottle and then throw it away, okay? So controlled substances and scheduled substances, those have to be counted each time one is removed. It's counted prior. You put in how many's in the drawer, and then you take one out, and then that machine's going to keep track of it. Okay. If you have to waste part of that narcotic, you have to have someone witness you wasted, and then they're going to sign behind you saying that you wasted it. Also, when you pour narcotics out of the automatic system, you have to have somebody sign behind you showing that, hey, she did only take one or two or whatever the order was. And then if it's a facility that doesn't have a locked automatic dispensing system, then the narcotics or the controlled drugs will be in a drawer that's locked, and you'll have a book where you sign out. So at the beginning of your shift, you'll count those narcotics. You make sure that they have everything that's supposed to be in there is in there, and then you and that nurse will sign off saying that, hey, everything is there. Then throughout your shift, as you're giving those controlled drugs, you're going to sign it out under that patient's name in a binder. And then at the end of your shift, that person who's coming in to relieve you, you will count those narcotics again. Just make sure that everything is there, or that everything you gave was actually signed out. All right, so So this right here is a combination drug. So you have two different drugs here. Okay, so it's giving us the dosage for both. Okay, now actually, also somebody write down page 193. Okay, Bactrim DS. Remind me, I want to again write this one on the board and go over it with y'all in person. Okay, so we need to go over the combination, how combination drugs are dosed. Okay. All right, black box warnings, y'all. This is just letting you know that, hey, this drug can be pretty serious. It can cause death or severe adverse reactions if it's when it's taken, so you want to monitor it closely. Okay, so anytime you have that black box warning, it just means it has some severe possible side effects. All right, let's see. All right, so unit dosing packaging, that just means that whatever drug you're giving, it's in an individual package dose, okay? So these might be an individual dosage of lactulose, okay, which is a laxative, or it may be an individual, this right here looks like a cough syrup, okay? So when you just open this, it's going to give you all the information that would be on that package is also going to be in there, okay? These are individual or single dose vials. This looks like a multi-dose vial. And then these medications are single dose. So on the back side of these, it's going to have the drug, it's going to have the dosage, it's going to have the expiration date. And so you want to verify that you do have the right drug and you give it. Same thing with these. There's just individual. These are going to be your patches. This is Metamucil, which is a fiber. All right, so over-the-counter medications, it just shows you the breakdown of the labels. It's going to have all the information on the front here, and then it's going to tell them about the drug. It's going to tell them the active ingredients, what's going to be used for, any warnings, and then active and inactive information, and then also directions for use. And so if you've ever looked at anything over-the-counter, they all have to have that information found on the package. Okay. All right, so I would recommend going through before the exam and doing some practice, these practice label questions, because again, you will have some labels on test 4 that you will have to pull the information from it to make sure that you can answer the questions about labels. Okay. Alright, so don't forget under quizzes, you'll have a quick little quiz about these 3 chapters, and that is going to show me proof that you have gone through these this video for the first portion of your class.